Right now on Up with KREM, we are nearing the 1-year mark of the first COVID-19 patients arriving in Spokane. This morning, I am live just outside Sacred Heart Medical Center talking about what we've experienced in the past year and what we can look forward to this year.
I think I felt a lot of the things that they felt as well on that day.
The pandemic has changed many things about the past year, but this morning we hear from the manager of Providence Sacred Heart's Special Pathogens Program about the changes she has seen.
Like every university, WSU had to adapt to COVID regulations, but the changes didn't stop them from graduating the 2020 class of nurses.
So it's just been really interesting to kind of have that be your first nursing experience.
We talked to the school about how they made that happen.
Some of our favorite things are starting to recover in the pandemic. This morning, we want to know what you are excited to see come back in 2021.
Up with KREM starts right now with Jen York, Joshua Robinson, Jeremy Legoo, and Dana Marie McNichol.
Well, good morning. Happy Friday, everyone. Thanks for being with us here on Up with KREM. I'm Jen York, live this morning here in Spokane. Today is nearing the 1-year mark of the first COVID-19 patients arriving in Spokane. That's actually tomorrow, but it was today, 1 year ago, that we learned that Spokane would receive several patients from California. So this morning, we're going to walk you through what we've experienced here in the past year, but also what we can look forward to this year. So let's go back about 1 year and what we were looking at. Those patients that I was talking about from California came from a cruise ship. Experts flew them to Sacred Heart Medical Center to seek treatment at the Special Pathogens Unit. And it was the first time that we had talked to you about these first cases of COVID-19 here in Spokane. We learned a lot from a panel of health experts from Providence and the former Spokane County Health Officer, Dr. Bob Lutz. Now, at the time, they said there was no threat to the public.
And I emphasize this is a controlled situation. There is no risk to the residents of Spokane County by bringing these individuals into our community for care. In general, however, the risk to the general public of the novel coronavirus, of COVID-19, remains very low.
Of course, they were talking about the Special Pathogens Unit. It is very unique to our area, and that's why they chose to bring those patients here. There's nothing like it around us, so that is the specific reason why they were brought to Spokane. However, in the following weeks, no one could have guessed how the pandemic would have changed our lives. Less than 1 month later, the Spokane Regional Health District announced 3 confirmed cases in Spokane County in the community spread. Since then, our cases have steadily climbed. And the single day high came December 8th with more than 680 cases. And of course, this morning we are taking a look back, and we're also taking a look forward. Here today we have 2 COVID-19 vaccines on the market. Several more are in clinical trials. And right now, lawmakers are also working to pass a 3rd coronavirus relief bill. And of course, this morning we do have team coverage. Joshua Robinson is speaking with the manager of that Special Pathogens Unit. Again, that's where those first patients sought treatment here in Spokane. Tim Pham is talking to a local restaurant owner who's had to weather the storm this past year, dealing with shutdowns, takeout only. We'll be talking to them about what it's like now moving forward. And Dana Marie McNichol will be talking about what you have to say, what you remember from this past year and what you are looking forward to. I'm loving the responses so far. I know this has been a tough year for everyone. And so far, everyone who's texted us saying what they're looking forward to is really, really positive. I'm getting a kick out of some of your answers as well. So text those in, 509-448-2000. In the meantime, here we are, of course, waking up to a little more snow on the ground. Jeremy Legoo joining us back at the station this morning. What else can we expect, Jeremy, as we head into the weekend?
Jen, everything. What do you want? What do you want from weather?
90 degrees and sunshine.
Okay, maybe not that. So almost everything. But
Maybe it's just in my mind.
Oh yeah, okay. Well, maybe turn that thermostat up for like an hour and then go, I gotta pay for that, and then turn it back down, and then that'll be enough to get you there. But by Monday, we are talking much warmer temperatures. We are going to be knocking on the door of 50 degrees. So it is going to be a bit warmer out there, and that is a bit of good news, but we have to get there first, and that is kind of going to be the biggie as we go through the day today. So, a few things to know as we start early this morning. How about? All right. Temps hanging out in the 20s. You see a couple of light flurries coming down. That's going to be about it for the snow. I don't think any additional accumulation here in Spokane. Most of that moisture moves its way out. We're seeing a bulk of that moisture stay down to our south, which is where we expected this to be with this storm. But look at what warm temperatures are doing on the backside of it here. Starting to get some wintry mix, maybe even a little bit of rain moving into some of those locations. Off to the north, all of our snow is kind of moving out. I don't think we're done with it in the mountains or even up and over Lookout Pass, so be ready for that later on today. We still have our winter weather advisory in place. This is for Friday morning. For us here in Spokane, that lasts another hour with a little more snow coming out, but it's not much. All said and done, negligible amounts in most locations, considering we've already picked up 2, 3, even 4 inches in parts of Idaho this morning. By this afternoon, temps in the mid-30s, so we should start melting a little, but it's not until this weekend that we get that big shift in the forecast. All right, Nicole. Ooh, that is a lot of snow. I'm loving it. Where are you and what's it looking like?
Jeremy, it's snow and more snow. So we're up on Division right now near Franklin Park Shopping Center, and check it out. This is where things haven't been plowed. Look at how much snow that is. Amazing. Fun to play in for all the kids, of course, and, you know, people like me who love the snow. But there is going to be issues when you're driving. So when you actually move over to like the parking lot areas, there's still a good amount of snow on the ground here, and that's driving. And when you push that snow away, you get this layer of ice underneath, and that's what's really causing the problem. So we've got a little bit of powder on top of the ice, but as soon as that powder goes away, you end up with those slippery conditions. So obviously here, this is a parking lot, it's been plowed, but there's not much traction on it. It's when you get onto those main roads here like Division where it looks okay, but then it's actually really slippery, that's where it's gonna be most dangerous. So we were driving up here to this parking lot and tried to stop at the stoplight and had a lot of trouble stopping. We've been slipping and sliding all morning driving in these road conditions, and that's just because of this layer of ice underneath. We've just seen snow on top of snow on top of snow for the past week, and that's causing these really slippery conditions. So make sure, like we always say, go slow, take your time, and be careful on the roads this morning to make sure things go smoothly for your commute. Live in Spokane, I'm Nicole Hernandez.
Some good advice, Nicole. Thank you. Well, as Jen mentioned, tomorrow will mark 1 year since we first started talking about COVID-19 in our community. This morning, let's take a look back at some of the biggest moments in our community.
We're talking about the patients that are here in town receiving care from our local doctors.
The risk to the general community about this particular process is 0.
This special area inside of Sacred Heart has rooms that are specifically designed for airborne infections like the coronavirus.
The hospital told us yesterday the Department of Health and Human Services requested that these 4 patients be brought to Spokane.
The first 2 of the patients arrived just before noon yesterday, and then the last 2, making it 4 total, got in around 4 p.m.
Patients who are in our facilities now can feel safe. Being prepared is a much better opportunity for us to care for our community competently and carefully.
This is Washington's Stay Home, Stay Healthy order.
Washington's stay-at-home orders go into full effect tonight.
We have a bipartisan agreement on the largest rescue package in American history.
It just doesn't feel real, and I think a lot of us are, in shock.
We've got businesses right now that are barely making it at 50% capacity. I can't imagine if they had to close their doors. I don't want to see that happen.
In a decision effective today, Dr. Bob Lutz is no longer serving as the Spokane Regional Health District Officer.
Inaction here is not an option. We have to take bold, decisive action, and we are doing that today.
It's preposterous to think that a restaurant can survive only on takeout and outdoor dining.
Today is a landmark day in our country in the battle against COVID-19. An FDA advisory panel will vote today whether to recommend emergency use authorization for Pfizer's vaccine.
This is one of the greatest scientific accomplishments in history.
Health leaders are warning us that the darkest days of COVID-19 might still lie ahead. As you can see behind us, the Spokane Arena now fully transformed into this mass vaccination site that will open within the hours.
And today, health leaders hope to vaccinate up to 500 people.
And that brings us to today. Jen, I want to talk to you about what moment stands out to you the most.
You know, I don't know if it's a single moment or the past year. I think it's been really remarkable to see Spokane and the Inland Northwest really gather together, support our local businesses, do what we can to rally around each other. I feel like that deserves a huge pat on the back that we've made it 1 year now. Of course, there's still some, left to go here, but I'm just so impressed with our community and what we've done in the past year.
Absolutely.
What about you?
You know, just watching that look back story that Nicole Hernandez put together, by the way, great piece to take a look back at the last year. Taylor Vito and myself, we were the first reporters that got to ask that panel of experts those questions. We pressed them about what the risk is to the community. You heard it there. And, they assured us then that, this was going to be contained to just the pathogens unit. Obviously, this time last year, we didn't know what we know now. So it's a little eerie looking back, thinking that it was just 4 and now, obviously thousands. So yeah, a lot to ponder 1 year later for sure.
Yeah, we've learned so much. Yeah, that press conference that you were mentioning, talking about no risk to the public. Of course, that meant from contamination from the special pathogens unit. But yeah, we know a lot more now, of course, 1 year later.
Yeah, and not long ago, you were at the Spokane Arena talking about the first vaccine mass site in our area.
Mm-hmm. Yeah, and it opened 3 weeks ago. Of course, that's huge for our area and getting people vaccinated and access to those vaccines. Well, since the opening, they've been able to administer about 11,000 doses of the vaccine, and now it's starting to accept second dose appointments as well. However, the Washington State Department of Health says the state still does not know when eligibility will expand to include more age groups and people with living with underlying health conditions. That's even with the promise from President Biden there will be enough vaccines for every American by July. Right now, the DOH says it is trying to make sure its limited COVID-19 vaccine supply is reaching the state's most vulnerable patients. However, many of the vaccines meant for next week's appointments have been impacted by the weather. Of course, we know we've got snow here, there's snow on the west side, so it's delaying some of the shipments of those vaccine doses. And of course, people are still in need. They still need help. The president's administration continues to push for his $1.9 trillion COVID relief package. The House of Representatives will likely vote on that next week, and then it will go to the Senate. Democrats hope to approve that during the early March, mid-March area before those extra additional benefits expire again on March 14th. So as we look forward here from the 1 year mark, we're beginning to talk about the return of some of our favorite events. We've already learned a number of our favorite events here in Spokane are expected to return late summer, early fall. Pig Out in the Park, of course, we know that's a favorite. That's expected to run September 1st through September 6th in Riverfront Park. I know foodies love that one. It also is going to come with 6 days of music as well. Hoop Fest also making a comeback this fall. Typically, it's around the end of June. Now it's going to be moved to September 11th and 12th. And the Spokane County Interstate Fair is also coming back. That's slated for September 10th through the 19th. Football fans, my Cougar fans, Eagle fans, there is some speculation that we might be able to have fans in the stands come this fall, but those decisions will come later this year. And I know someone had texted in that they're really excited for this next event if it does take place. The 80s classic, the Monsters of Rock show, might make a return to Joe Albee Stadium. The Spokane Public School Board will be making a decision about that show coming up next month. However, even with all of these plans in place, we are still in the pandemic currently, so you can expect that there will be social distancing rules in place, of course, to keep everyone safe. Of course, Joshua, we are live this morning, again, outside Sacred Heart Medical Center, nearing the 1-year mark of the first COVID-19 patients arriving here in Spokane. We've come a long way in the past year, and it's really positive to see a lot of you at home texting in this morning, talking about what you're looking forward to, what you're proud of for our community. It's really heartwarming to see.
And some of those things, Jen, I'd forgotten about too over the past year. I feel like there's so many things that it's easy to gloss over and not remember right away.
You know, everything changes, it seems by the day with the pandemic as we learn more and more about coronavirus and our response. And of course, now how do we get people vaccinated? So I don't think that'll probably change here soon. But yeah, it's wild to see how much we've done in the past year.
And we do want to continue to field your responses all morning long on this special edition of Up with KREM. We're also this morning taking a look back at the last year for an entire graduating class of nursing students who entered the workforce in the middle of the pandemic. This morning we're talking to a Coug alum about their first year on the job.
And this morning we want to continue hearing from you. What are you excited about coming back? Text us your answers, 509-448-2000. We're going to talk about them after the break and all morning on Up with KREM. We had someone text in that they cannot wait for margaritas. I like where your head's at on this Friday morning.